Thanks very much, Brooks. That really was good. It's good to hear about that sort of interaction at the national organization to public policy leader effort. I think that's very important. Our next speaker is Lydia Kimball. She's a landscape architect from the company in Baltimore, Mahan, Rykiel Associates, and she has over 25 years experience in working with design projects for senior living, healthcare, academic facilities, and particularly is interested in the areas of sustainability and low-impact development. And we're really glad to have her here to present her programs. Lydia? Did you get the button training? You
No,
just
give me
avoid
the button training here
avoid the
quickly.
center button.
Nope. Uh-oh. Well, I have it on a flash drive.
Here it is. It's down one. There.
Nope.
Oh, no.
I have it on a flash drive. I'm not sure that it's gonna, I think the version.
Since that's Joyce Lee's topic, click on Joyce Lee's with your topic.
Oh, there's an idea.
Joyce and Joyce is gone, right? So she's.
I thought we saw that.
Yeah, we saw Joyce.
No, but I thought I saw yours when you set it up. I have it also on a flash drive.
Can you look at, see, if you go through each one, you'll be able to see the picture down here. That's not it. Nope, nope, nope. I really was invited. I'm an interloper. Well, Brooks actually gave me a great segue because I don't know if anybody noticed, but a lot of his slides were actually landscape architecture slides. So, nope, I'm not seeing it. See, I can see a little preview here if we go through, you go down each one. I'm sure it's in here.
I saw Kimball here. Oh, put the
Yeah,
wrong name on
it's the wrong name on it.
No.
Keep going. Keep going. Nope, keep going. Nope. Tell me it's.
Are you looking at my flash drive now? or
I'm
you-
looking at this.
What's
I'm-
loaded there? Oh,
Nope.
so the co-benefit people. It should be on my flash drive. I have a folder that is for HiBR here, folder. And there.
There we go.
Yeah, try this
Try that one. There you go. Yes. That's it.
Okay.
Here we go.
Standing over.
Thank you.
The right and this one.
Okay, only right. Okay. Whoops, I'm ahead of myself. Okay. Thank you for your patience. I'm feeling a little bit inadequate because I'm only a landscape architect. I'm not a scientist, I'm not a statistician, I'm not an economist, I'm not anything but a landscape architect. And I have been one for 25 years. I'm here representing a slightly different point of view. I'm going to show you sort of the boots on the ground. This is what we're doing in design for landscape architecture. So I'm going to show you a little bit. This is actually not a commercial for Mahan Rykiel, but they are all of our projects because we have an amazingly diverse practice, and the issues of health and wellness are really important to me, and they're important to all of the sectors that we work in. And as you'll see, they're really quite diverse. This is a complete snapshot of relevant research. Gardens and health and wellness have been around for a very long time. I think the pivotal study for us was Roger Ulrich's study that said views to nature have measurable positive impacts on patient outcomes. And so for us, that's where evidence-based design started for us in landscape architecture. All of these other things, all of these other studies and views of nature and wellness and health are all important as well. And they all inform what we're doing as designers, all the way down to Gary Cohen's work on the rising disease burden and understanding that things in our environment are not healthy. So we've heard all of this so far this morning, which is awesome. I'm going to touch a little bit here on trends as I see them in the AE industry. We're trying very hard to design places that get people outside, that get people to engage with their natural environment, and to also design environments that are healthy. I think again, a lot of this is repetitive. You guys, this is awesome. I'm preaching to the choir. The recognition that physical health is important, but emotional and social health is also important. And all of this is evidenced by the various metrics and the various guidelines and such that are now in it's sort of everybody's world, the world of LEED, sustainable sites, Green Guide for Healthcare, and even in the state of Maryland, the Department of the Environment, Chapter 5, is mandating clean and better approaches to stormwater, and that's had a big impact on the way we approach site design. So my one firm's perspective, I'm going to show you a few of our market sector kinds of projects and show you how the ideas of health and wellness are incorporated in all of those sectors. Hospital environments are actually the easiest ones, and those are the ones that are closest to my heart because I work a lot in the healthcare environment. Each of these images are projects that we have done in a variety of clinical settings, acute care hospitals, outpatient buildings, and the like. We are really careful to have environments that encourage not just patients, and frankly, patients are probably the least able to enjoy all of these spaces. It's really staff and families, and getting those connections to the outdoors, which are critical. In senior living environments, these are also really easy. This is really easy to do. Finding places and opportunities for outdoor environments that are close to the building, ways to get people outside, get people to walk, an indoor-outdoor relationship. That's what we do in landscape architecture, and finding places for individual and personal spaces. Schools and neighborhoods, we do a lot of work, K through 12, as well as a lot of higher ed projects, and the health of the environment and outdoor learning are all wrapped up together now. The ability to design outdoor classrooms and having the environment be the classroom is really pretty great. This middle image is a stormwater retention area, again, mandated by Chapter 5. It gives us an opportunity to bring the hydrology of a site right up close to the building. Even retail and hospitality, believe it or not, we're thinking about health and wellness issues. This top image is from a big shopping center in Anne Arundel County outside of Annapolis. Excuse me. And the stormwater issues were front and center in that project. It enhances value to the owner. The pictures on the bottom I love. They're before and after of a rehabbed, just a strip center. And the owner of had a whole series, the developer had a whole series of these. We've done probably 20 of them. But all the improvements of these existing strip centers involved what they call improvements 12 feet and below, everything that a consumer, a customer could see or touch, and it was all about landscape and green space. So just the addition of the green space in these landscape improvements had measurable outcomes, which we love in the retail industry because that translates into money. And the measurable outcome for that particular owner was a 25 to 30% increase in their consumer and their spending. So that was very measurable, very direct, and they think we're geniuses. So there are still challenges, and all of these have been addressed already by other folks. The budget considerations are significant. Timing is key. Getting landscape to be not thought of as a frill, to be thought of as integral to the health and health, safety, and welfare. That's actually what landscape architects do. And in terms of maintenance, again, that's all about budget too. If you value your environment, you're going to maintain it, you're going to dedicate money to it. I don't know what's the phrase, show me your budget and I'll show you what you value. And it couldn't be more true with regard to landscape. So that's me. Thank you. Thanks for your patience.